Jeff Crilley, and I'm honored to have Dr. Christine Stiles with me. She's one of the leading plastic surgeons in all of North Texas, and welcome to the show.
Thank you so much for having me this afternoon.
Well, we have a lot of stuff out here, so I have to recognize what's going on in front of us. Can you kind of give us a tour and tell us why you brought these props in today?
Sure. So this is a display that we use in the office to educate our patients about breast implants. And breast implants now are available in not only different sizes, but multiple different styles. And that's what allows us to really pick out the best shape, style, and size for each patient. So if you look here, these three implants look very different, but they're about the same volume. And so this is the SXX implant, which is your extra high profile. This is your SSF, which is your full profile, and then this is your moderate profile. So below this, there are two other low profile styles. But what this does is this is kind of the one we picked for someone who wants a high, round, almost fake look. This is for someone who wants a lot more fullness on the top. Mm-hmm. And this is my favorite one for the patient who just wants a very natural look. And then what we have here with our little gummy bear display shows the increasing cohesivity, which is, if you think about it, it's the stickiness of the silicone on the inside. Mm-hmm. They all have a nice, strong silicone shell on the outside, but this is kind of your soft, this is your medium, and this is your firm implant. And we can use these different implants to, again, customize what kind of look the patient and feel the patients need.
Okay, Dr. Stiles, there's been so much in the news, and I know there's a lot of misleading information, and women are scared sometimes about what they read in the news. So help educate us on.
So breast augmentation is one of the most popular procedures in the United States. And over the past few years, there has been this almost fear, stress, and anxiety about something that is being known as breast implant illness. Because social media is such a part of everyday life, women are able to connect on a completely different level than we have in the past. And unfortunately, a lot of women who are thinking that they have breast implant illness actually have other disorders that may or may not be related to their implants. Back in the early 90s, there was a lot of fear, anxiety, and I almost feel like we're reliving the early 1990s as far as women being afraid that their implants are hurting them. And right now, there's no hardcore science behind it. Back in the 90s, there was really no increased incidence of diseases like lupus and scleroderma in women who had implants and who didn't. And now there are many women who are living in fear that the implants are causing these problems. And we're seeing more and more women come in asking to have their implants out than to have their implants put in. And when they're asking to have their implants out, they just want the implants out, they want the capsules out, and they don't want any replacement. Sometimes if they want more volume, using your own fat to increase the breast size is a great alternative. But there are a lot of women who come in and hope that having the implants removed will make them feel better. And some of them feel better and some of them don't. And so sadly, again, a lot of women are starting to get unnecessary surgeries just because of a fear.
Yes. And so when a woman comes to you with this fear, how do you work with her? How do you give her the facts? I mean, how does that work?
So basically, I sit down and I explain, right now, the plastic surgery societies are spending a lot of money in conjunction with the breast implant manufacturers to figure out what truly is going on. And so the American Society for Plastic Surgeons and the American Society for Aesthetic Plastic Surgeons are really trying to look at what problems the women are complaining about and how those problems may be related to implants. The issue that we see is a lot of women come in and they have very varied complaints and very vague complaints. And they're problems that really can make your daily life miserable, like chronic fatigue or joint pain or unexplained rashes. One of the more common ones that we see a lot is their hair falling out. And a lot of them are just undescribable problems that can be pointed to many different disorders. A lot of the symptoms that they complain about are similar to what you see with hypothyroidism that's not controlled. And so there's a point that we need to come to from the medical community and the general community and figure out which are related to the implants and which are not. I mean, I've taken out implants and the capsules and they look completely fine to me. We send them off right now and there's nothing that we can see on pathology that would cause a problem. But then I've also taken implants and hard calcified capsules out of women who had no problems at all, except the implants were very old and just needed to be replaced. And so we're in this very tenuous time as far as figuring out what the best answer really is.
Yes, and I should call attention to, you're a female plastic surgeon, and that's fairly uncommon, isn't it?
Yes, we are a minority in the plastic surgery community, but it's growing year to year. And even in the medical community on the whole, I believe the 2019 class was the first time in Texas that women actually outnumbered men.
Wow.
In the entrance class. And it's interesting because the vast majority of patients who go to a plastic surgeon are female.
Yes.
And on the flip side, the vast majority of plastic surgeons are males.
So do you find are female patients more comfortable with a female surgeon?
The ones who come to me typically are, because a lot of my patients will seek out a female plastic surgeon. And I mean, in Dallas, we're actually fortunate that we have several female plastic surgeons in the Dallas and surrounding communities. And it's nice to have, you know, other women who are in the same field. I would say that actually the Dallas community is very welcoming to female plastic surgeons and I think female physicians in general.
Yes, and I have to say that, like, if we went back 20 years ago and we talked about plastic surgery, there's something of a stigma attached to it. Oh, you're vain or whatever. And now I think it's almost a badge of honor, especially here in North Texas. I mean, you want to take care of yourself. Is that the way you view it?
Well, I look at it as I think people are more connected with other people who have plastic surgery just on a daily level, on a social media level. Interestingly enough, I came out of medical school planning to be a pediatrician, and my interest in plastic surgery had nothing to do with Hollywood and the cosmetic world, and it started with the cleft lip and craniofacial world. And as I went through training, what I really saw is that there is a certain area of insight that medicine lacks in treating women who come in for plastic surgery, because a patient comes in and there's a body part or a feature that has bothered them from years and affected their life, and then we make them talk about it, we measure it, we photograph it, and then what's nice now and compared to 20 years ago is we can actually use imaging to show them what they could look like and
Yes.
what changes we can make. And it's not about being vain, it's about feeling good about yourself. Mm-hmm. And I think, you know, the other aspect is people are doing younger things older.
Sure.
For example, if I just look at my group of friends, we all went through high school, college, graduate school, medical school, law school, any kind of advanced degree, and we all wound up having our children later in life. So when you do that, you are naturally forced to do the things that, 35-year-olds are doing when you're 45. And it just continues as the children get older. And then you're always around other families with younger parents or older parents. I had a very big realization this year because I realized that I am now the age that my grandparents were when I was growing up. And so I think about how, and I had a very vibrant young set of grandparents, and they were fabulous and they were my favorite people, but they always look old to me.
Sure.
And so now there's a just social awareness of looking young and feeling young, and we're always in front of a camera, whether it's your phone, your tablet,
Yes.
your computer. I remember growing up, my uncle had this huge video camera with this horrible light that he would bring out every New Year's Eve, and that's daily life.
Yes.
So
Well, and I think you speak to everybody. I think under 60. I'm 56. I turned 56 yesterday, and I have no intention.
Happy birthday!
Thank you. I have no intention of ever looking old.
Right.
Why would you want to look old? And when I grew up, you saw the Waltons on TV. You saw old people on TV. I challenge you to find somebody with gray hair on primetime television. You don't see that anymore. And I'll tell you a little story about my daughter. She's now 29, but when she was 22, she came up to me and she furrowed her brow and she tried to make a line in her brow, and she said, "Daddy, I need Botox." So I think you have a whole revolution of young people who just can't even imagine getting old.
Well, and they don't, because they're able to, in seconds look at themselves younger or look at themselves better. I mean, there are a lot of articles that come out about, people who want to come into the office and they want to look like they do with the Snapchat filter. Or in my patient population, we see a lot of mothers, we see a lot of professional, both men and women, who really can't look old because they're in front of a camera or they're selling something, and they need to look young and they need to look vibrant. And the other thing is, I think a lot of people, especially in Dallas, work hard to take care of themselves. So they're living healthier lives and they are much more active, and they're going to fitness clubs and they're taking care of themselves so that they don't look older. And
Yes.
the concept of doing these minimally invasive procedures and staying out of the sun and taking care of your skin in your 20s and 30s and 40s is a great thing, because that concept of wait until you're 60, have a facelift and try to look 40 is gone.
Right.
It's maintaining the volume and maintaining that look of maybe you're 40, maybe you're 30, you can't
Right.
really tell.
And you're something of an artist, aren't you? We all know celebrities who have gotten bad plastic surgery and it didn't come out right. A great plastic surgeon is an artist who nobody knows that they had anything done.
The best plastic surgery outcomes are the ones where you just look at that person and they just look great. They look rested, they look young, they have maintained their features of how they looked when they were young. And so if they're 60 or 70, they maybe look more 50, or they don't have an old look. And the celebrities who you look at and just think they have that glowing skin and they look the way they did 20 years ago are the ones who have had great plastic surgeons, or they have incredible genes, or they have the fountain of youth in their backyard and they live in it. I mean, I had the fortune to go to the Jennifer Lopez concert this summer, and she looked and danced and she was amazing. And she kept up with people who were clearly 20 years older. 20 years younger than she is.
Yes.
Without missing a beat. And I think Cher looked phenomenal in Mamma Mia too.
Absolutely.
And I mean, I think she's just a beautiful woman, and she has maintained that same look, and just she's someone that everybody wants to look at like.
Absolutely.
So.
Well, we're out of time, so please give everybody your website, and we're going to put it on the screen. Go ahead.
Okay, it's www.drcstiles.com.
Dr. Christine Stiles, www.drcstiles.com. Thank you for being on the show. You're gonna
Thank
have to
you
come
so
back
much for
again.
having me.
You were awesome.
I'd love it.
All right, that's it for now. We'll see you next time.